Good morning, everyone. Welcome. Welcome to the second annual CPH Frontiers in Computational Precision Health Conference. We are delighted to welcome you all today. I'll start with maybe just a couple sentences about the history of computational precision health. So we were founded about 5 years ago as a bold bi-campus initiative to really bring together the best of UCSF and UC Berkeley in the computational and health sciences, which with, I think, quite a lot of foresight in retrospect about the potential for computational health advances to truly transform how we improve health and deliver health care. So now we're 5 years in. We have a flourishing bi-campus PhD program. We have amazing faculty, both appointed in computational precision health and about 90 faculty as part of the program joint across the two campuses. And we also have this fantastic annual conference. So we've got an exciting agenda here today. Ida's going to introduce our keynote speaker for the rest of the day. Really fantastic panelists from across the board going to be speaking to advances in large models and AI, the evaluation of new innovations in health AI and how we make sure they're safe and build trust, and really hearing from thought leaders from the front lines of clinical deployment and direct-to-consumer deployment as well. Have some fantastic interactive sessions, and really looking forward to engaging with all of you today. Also just calling out a spectacular list of attendees who are going to be attending from really across the sectors, so both private sector, academia, government, and nonprofits. So looking forward to a really fun, inspiring, and thought-provoking day, and I will hand it over to my co-director, Ida Sim.
Thank you. Echoing Maya's welcome, we have crafted today's agenda to explore not just the research frontiers of computational precision health, but also the human frontiers. The future of AI in health is only beginning to be written, although Bob has already written the book on it. We'll be hearing shortly. But I encourage you to consider over the course of the day who is writing that future, who has agency to write that future, who is being kept from writing that future. Look around you, the person who's sitting next to you, behind you, in front of you. Hope you have a great day. Hope you engage with our panelists and our wonderful speakers, and also with each other. So I'm going to let Maya introduce our opening speaker.
So our opening speaker is Dr. Catherine Lucy. She's the Executive Vice Chancellor and Provost of UCSF, which means she's the Chief Academic Officer at UCSF and is responsible for the academic programs and operations. Dr. Lucy is a renowned leader in medical education. Prior to being EVCP, she was the Vice Dean of Education and Executive Vice Dean at UCSF's School of Medicine, where she oversaw the training of medical students, residents, and beyond. Nationally, Dr. Lucy is a member of the National Academy of Medicine and has served in multiple leadership roles in physician certification, including past chair of the American Board of Internal Medicine. In recent years, she's been leading UCSF's response to AI in medical education. We are so grateful to Dr. Lucy for her steadfast support for CPH and for being here today. Thank you, Catherine, for joining us for opening remarks.
Thank you very much. I'm going to go off script for a minute and say that I think this last week, with the journey of Artemis II and the successful recovery of the astronauts, has been an incredible boost for the scientific morale of the country. It shows how important science is, and all of that work would not have been possible without tremendous data, technology, and informatics. And similarly, we're here today to celebrate the Frontiers in Computational Precision Health, another incredible program that will likely change lives going forward. So on behalf of UCSF and the UC Berkeley Computational Precision Health Program, it's wonderful to welcome you today to this landmark conference on artificial intelligence in health. This is an exceptional audience of leaders of the CPH, but also in the audience, academic researchers, clinicians, graduate students, and industry leaders who are at the forefront of transforming data science and healthcare as we know it. This conference is a truly groundbreaking program that represents the best of what collaboration within and across the University of California system and beyond can achieve. CPH is a joint initiative between UCSF and UC Berkeley, two institutions that are world-renowned for their excellence in distinct but very complementary fields. UCSF has unparalleled expertise in health professions education, clinical care, translational science, and clinical informatics. And Berkeley is a dominant force nationally and internationally in artificial intelligence, computer science, and statistics. Together, they have created a program that is now a clear national leader in health artificial intelligence. Both UC Berkeley and UCSF have internationally recognized expertise in graduate education. And the CPH graduate program is a unique space where innovation thrives, where exceptional faculty mentors some of the brightest students in the country to tackle the most pressing challenges in healthcare. Students who come from computational science and biology, as well as healthcare and healthcare delivery, to tackle these problems. Today, the program stands as a shining example of how academic collaboration can drive not only technological advancement, but ethical and equitable solutions to improve patient care and patient lives. As artificial intelligence transitions from research to the front lines of patient care, we find ourselves at a critical inflection point. The sheer computational power of massive scale models offers tremendous opportunities to accelerate diagnosis, personalized treatments, optimize healthcare delivery, and change the way we conduct education and discovery science. Yet, we must also ask ourselves, who benefits from this transformative work? How do we ensure that artificial intelligence is used responsibly, ethically, and equitably? These are questions that demand thoughtful exploration, and they are at the heart of today's discussions and discussions for decades to come. This conference is a deep dive into work shaping a more desirable future of health, bringing together pioneers, policymakers, clinicians, industry leaders, and most importantly, the voices of patients and frontline care providers. Across the day, you'll hear from some top leaders in artificial intelligence and health, as well as gain firsthand insights into the opportunities and challenges we face in applying these technologies in real-world settings, like UCSF and across the UC system. It is my hope that today will be a thought-provoking experience for each of you, a chance to push the boundaries of your thinking, to form new collaborations, and to leave inspired by the possibilities ahead. This is what we do in academia. We foster moments where ideas converge, where leadership emerges, and where the future begins to take shape. At UCSF and UC Berkeley, we are proud to be defining that future. Together, we are leading the way in shaping how artificial intelligence will transform healthcare and our academic missions of education and research, not just for the sake of technological progress, but for the betterment of patients, communities, and society at large. Thank you for being part of this journey with us today. I'm sure it will be a day to remember, and I'm so grateful that you're taking time out of your busy schedules to participate, to share, and to envision what the future world might look like.